My name is Ty Marin, and my project is called Empowering Women with Options. It is a public service announcement to provide women with educational as well as access to services for reproductive health care. So reproductive health and sexual health matters to me because everyone needs reproductive health care, whether someone is sexually active, non-sexually active, regardless of their sexual orientation. So the three most important things a female should know about her reproductive health is 1, knowing her reproductive anatomy, how a pregnancy occurs, how sexually transmitted infections are passed, as well as knowing how to prevent or reduce her chances of getting an unwanted sexually transmitted infection or unplanned pregnancy. Terms are changed all the time. So STI stands for sexually transmitted infection, and STD stands for sexually transmitted disease. Person uses the term STD or STI, they are talking about, in general, sexually transmitted infections that can pass through unprotected oral, anal, or vaginal intercourse, in some case, skin-to-skin contact. One of the most misconceptions a female may have about reproductive health or not having the right information would definitely be the reality of it. So a female may not feel that she's prone to getting an STI or unwanted pregnancy, the "it can't happen to me" syndrome. I would definitely say that the misinformation or just being misinformed about reproductive health definitely comes from a cycle of being uncomfortable talking about reproductive health, whether it be from a trusted older figure such as a parent, a guardian, an older sister, maybe a cousin, and it may be a topic that pretty much is just bypassed because of the uncomfortable feeling of talking about it. I do believe that minorities face a greater risk or just not having access to information in healthcare. One reason being, maybe there's a language barrier. If a person comes from a minority group and there's a socioeconomic barrier, then maybe they don't have time to learn a language within the community they live in. So if a minority lives in a community where the majority or the primary language spoken is not the language, their native language, then they may not be able to read the information that is available. They may not be able to communicate with the healthcare providers that are actually in the area where they live. If it comes to having access to healthcare, maybe there's not a clinic or a health center where they can actually receive reproductive health services. If it takes taking off work, well, maybe they can't take off work because they won't get paid. It may even come to a point where it's more personal as far as their spouse. And a lot of minority women may have a spouse to depend on. And unfortunately, they won't have a choice on whether or not they want to go to receive reproductive health services, whether it be to use a barrier method if the relationship is a sexual relationship. So currently there are birth control methods some will help protect a female from sexually transmitted infections as well as pregnancy. Others only help protect against pregnancy. In any case, birth control methods can be used in combination. Believe it or not, abstinence is a birth control method. Abstinence is defined as no oral, anal, or vaginal intercourse, and it is no exchange of bodily fluids. If abstinence is not chosen, now there are 3 methods that are currently available. Not only do they help protect against sexually transmitted infections, but they could also help protect a female from pregnancy. So there are male condoms. Male condoms come in a variety, whether it be flavored, non-flavored, lubricated, non-lubricated, with different funky designs, which are designed for pleasure for the person using them. So every individual is unique, and therefore they would probably like a condom that suits their uniqueness. Male condoms come with a package that has an expiration date. An expired condom should never be used because after the expiration date, the material is no longer good. So therefore, a female could be putting herself at risk of getting an STI or unwanted pregnancy because majority of the time, the condom will rip. And there are also female condoms. Female condoms are quite larger than male condoms. However, they are very effective at preventing the transmission of sexually transmitted infections as well as pregnancy. The female condom is inserted into the vagina, and the outer ring has to lie 1 to 2 inches outside of the vagina. In any case, the bodily fluids of the female's partner are contained in the female condom so that the bodily fluids are not being exchanged or the female's not being exposed to her partner's bodily fluids. Lastly, there is the dental dam, also known as the latex barrier. The dental dam can be used for oral intercourse on the vaginal or anal area. Although a pregnancy is not at risk, dental dams provide protection against sexually transmitted infections that can be passed through unprotected oral sex. And then there are other methods which do not help protect against STIs. However, they are available and they do provide protection against pregnancy. So there are hormonal methods and non-hormonal methods. There are hormonal methods such as the pill, which a female has to take every day. And if she decides that she no longer wants to take the pill because she is planning a pregnancy or for other reasons, then sometime after she stops taking the pill, she will become fertile again. There are also methods known as such as the ring, which contain the same hormones similar to the pill. However, the ring is left in place for 3 entire weeks. So the ring has to be placed in the vagina, and then upon being left in the vagina for 3 weeks, this ring releases hormones which are absorbed by the vaginal walls, and upon taking the hormones into the female's body, it protects her against pregnancy. The take-home message is that if someone decides to become sexually active, have the right information, make the right choices, and gain access to reproductive health care. Whether it be someone who is afraid that someone will find out that they're getting reproductive health services. Maybe it is someone who cannot fully communicate with their partner. What matters is that they are taking care of themselves and they are staying healthy. Interested in gaining access to free or low-cost reproductive health services, there are places such as Planned Parenthood Los Angeles, which provides those services, as well as different clinics around Los Angeles County. If someone is interested on how to gain more information about those organizations, they may log on to pplosAngeles.org, sexetc.org, sexetc.org, teenwire.org, teenwire.org, or there's also a new website called don'tthinkno.org. No spelled KNOW.org.